In the early months of 2009, Mr. D, a semi retired accountant, sought help from his general practitioner due to symptoms of tingling sensations, also known as paresthesia. He recounted how over the last several months he experienced constant numbness in his foot soles, coupled with stabbing joint pain around his arms and elbows. He found that even though his mind could identify tasks, his hand would not respond. Whilst driving his car, he described sometimes that his head would pull to the side without any control from him. His diminishing manual dexterity and peculiar head movements prompted a referral to a neurologist, leading to the diagnosis of Parkinson's. Fast forward to 2012, desiring further expertise, Mr. D sought a second opinion from a professor specialized in movement disorders. It was during this time that Mr. D also reported feelings of depression and fleeting thoughts of suicide. He was having trouble at home, especially with difficulties conveying the progressive and incurable nature of Parkinson's to his wife. He was also struggling with his finances. Now, it is important to note here that Parkinson's disease affects planning and decision making. So, when helping a patient with progressive Parkinson's disease, it is important to consider financial factors and get the right social work team involved. Stress can also exacerbate Parkinson's signs and symptoms, so having a good supportive network is very important. Collaborating with this neurologist, the decision was made to start citalopram, an antidepressant. In May 2012, Mr. D consulted the professor in movement disorders who initiated treatment with Azilect, offering an initial positive response. However, by early 2013, the progression of Parkinson's symptoms prompted the consideration of deep brain stimulation, also known as DBS, a surgical intervention. The professor explained potential risks, including death, stroke, infection, seizure disorders, and mood changes. However, undeterred and very determined, Mr. D underwent this bilateral subthalamic nucleus DBS in May 2013. The outcome was excellent, and Mr. D felt like he was back to normal again, with improved motor function and a reported increased quality of life. Yet complications arose during a trip around Australia in 2014. Mr. D noticed erosion of his implantable pulse generator in his chest, leading to infection. The subsequent surgery in 2014 involved removing the hardware, making Mr. D intolerant to the return of Parkinson's symptoms. Dopamine therapy had to be reinstated until a replacement IPG could be implanted again. Amidst this journey with Parkinson's disease, Mr. D faced a significant mental health challenge. Suicidal thoughts emerged, prompting immediate medical intervention. Factors contributing to distress included uncontrolled pain, recent reactivation of the DBS device, a divorce, legal battles, financial difficulties, and a limited support network. Treatment with a drug known as quetiapine was initiated, and Mr. D was closely monitored as an inpatient. Unfortunately, 3 days post-discharge from the hospital in 2014, Mr. D ended his own life. Amidst the stress of a divorce, financial and legal battles, and the progressive worsening of his symptoms, he had lost all hope. The coroner instigated an investigation into his case and made the following recommendations for management of Parkinson's disease patients. The first recommendation was that DBS patients are not prematurely discharged from the hospital. The second recommendation was that the arrangements are made and documented before discharge for their proper care and follow-up. And lastly, that there was clear arrangements for the patient to get help, as well as their family members, if there were problems after the discharge from the hospital. Mr. D's intricate medical journey underscored the delicate interplay of physical and mental health in managing Parkinson's disease, DBS complications, and associated life stresses. I hope this video has helped you to understand how important it is to closely monitor a patient who has been diagnosed with Parkinson's disease, especially if they lack social support. This coroner's court investigation has been published online, and I will leave the link below for you to access and review. I have also changed the patient's name to protect the patient's privacy. Thank you for watching, and please let me know if this content has been helpful to your learning. See you in the next video.